Hello everyone! Today, we shall be talking about the burning concern of dengue. We shall be learning all that we need to be safe from dengue and also what to do if we develop the symptoms. Let's begin it with Mr. Scienceify.
Dengue. Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. Causative agent: it is caused by dengue virus carried by female Aedes mosquitoes when it takes the blood of a person with the infected person. The main host is the humans. When a mosquito bites the infected person, the virus is circulating in the blood carried by the mosquito, after which it enters the midgut of the mosquito. The virus inside the mosquito is known as sporozoite. In the midgut or stomach of the mosquito, the sporozoite divides and transfers to the salivary glands after about 1 week, where it becomes ready to transmit in the humans. The infected mosquitoes then bites the humans where the virus enters the bloodstream. The WBC tries to destroy the dengue virus, but they are targeted and infected by the virus. The dengue virus tricks the immune system to get around its defenses and infect more cells. Then, it travels through the lymphatic system or blood vessels. The dengue virus spreads throughout the body. During its journey, the dengue virus infects more cells, including those in the lymph nodes, blood, bone marrow, spleen and liver, causing multiple symptoms. Diagnosis of Aedes mosquito. The mosquito can be identified by white and black markings on their bodies and legs, so known as tiger mosquito. They feed during the daytime with peak activity at dawn or dusk. This species is most active for approximately 2 hours after sunrise and several hours before sunset mostly, but it can bite at night in bright or well-lit areas. They mostly live indoors and cannot survive in cold weather and lay their eggs on stagnant water. The dengue mosquito lies from behind to bite ankles and elbows usually. The only way to differentiate between a dengue mosquito bite and a normal mosquito bite is that a dengue mosquito bite is much redder and itchy compared to a normal mosquito bite. Symptoms of dengue. Dengue begins abruptly after an incubation period of 5 to 7 days. During febrile period, first phase symptoms, after 2 to 7 days. Extremely high fever and vomiting as the virus starts infecting the cells. Skin erythema or red patches on the skin due to migration of the virus and WBCs. Pain in the back, limbs and the areas around the eyes or eyeball. Lymphadenopathy, that is enlargement of lymph nodes. Arthralgia, that is extremely pain in joints. So pain mostly occurs in joints, back, limbs and the bony parts, along with high fever, so dengue is also known as breakbone fever. In critical phase, infected person may suffer from leukopenia, that is extremely reduce in WBC in the blood, and thrombocytopenia, that is decrease in count of platelets in the blood. These two symptoms are tested in hospitals for dengue. The blood may come from nose, mouth, vomiting and stool, also in critical case. If you develop these symptoms, quickly seek the medical help. What to do if from dengue? There is no any certain vaccine till this date that can kill the dengue virus inside the body. The medications are given to reduce the effects or infirmities like fever, vomiting, nausea, joint pain, etc. Cetamol does the work perfectly for that. Do not consume high effective medications like ibuprofen, aspirin, naproxen, etc. unless prescribed by the medical experts. The work to cure dengue is done by the WBC or your immunity system. So, if one is infected by dengue, focus to strengthen your immunity power. Take proper balanced diet along with sufficient vitamin C. You must eat foods that contain vitamin B12, protein, and iron such as meat, poultry, eggs, liver, dairy products, green leafy vegetables, papaya, homemade dal, fruits and its juices, etc. Keep in mind that these things should be consumed in balanced way, not too excessive, that may make the body difficult to digest. Some of the foods you must avoid include oily and fried foods, caffeine, carbonated drinks, spicy food, and foods high in fats. Take proper rest, avoid physical and mental stress. Preventive measures from dengue. As dengue is transferred by mosquitoes, we need to be safe from mosquito bites. As the mosquitoes lay eggs in stagnant water, clear all the place where there is stagnant water. Don't store water opened, change water in the flower vase, keep your surrounding hygienic. Use insect repellent, traps, nets, wear long-sleeved shirts and long pants, and control mosquitoes inside and outside your home. Keep the doors and windows closed at dawn, dusk, and early evening to avoid the entry of dengue mosquitoes, or use nets on the windows. Remember, all these reports are made on the research basis. Do not fully depend on this or any other information solely. Go and seek medical help if you also develop the symptoms. Like and subscribe if you learned something. Thank you for being here.